Welcome to the deep dive. So the source material you've provided us, it's really a treasure trove on digestive health, hasn't it? Specifically for Americans over 55.
It really is. And that stat you mentioned, over half of people in this age group regularly struggling with things like bloating, IBS, or GERD. That's significant.
It really is. And our mission today, based on this source, is basically to pull out those key findings, understand why this happens, and maybe more importantly, explore the natural strategies the source suggests for finding some relief.
Yeah, that statistic really jumped out at me too, right away in the source. It just shows this isn't some minor thing for a few people. It genuinely impacts quality of life.
Massively, affecting sleep, mood, energy, even just going out and socializing. Yeah.
Absolutely. And the source makes a really crucial point there. We don't have to just sort of accept this discomfort as, well, part of getting older.
Exactly. There are active steps, things you can do based on this information to manage these issues for better comfort, more energy, actually enjoying food again.
Less anxiety, more independence. That shift in mindset from just accepting it to actively managing it. That's a really powerful theme running through the material, I thought.
It really is. So, okay, based on how the source lays things out, we're going to start with the why, right? Looking at those natural age-related changes and the impact of medications, which seems, well, huge and often overlooked.
Definitely.
Then we'll zero in on specific common problems, bloating, IBS, GERD, and explore the natural solutions and lifestyle tweaks the source discusses.
And we'll touch on that gut-brain connection, which is so important.
Oh, yeah. Clear up a few myths the source debunks, and then kind of look at how you might pull this all together into a personal plan.
It's quite a journey through the information, but yeah, we'll break it down conversationally. Focus on what feels most relevant for you listening in.
Okay, so let's start with that foundation. The source makes it clear. Digestive issues aren't exactly new, right? People have been looking for relief for ages.
For millennia, yeah. But what's interesting, especially in the U.S. today, is how the type and prevalence seem linked to our modern lifestyle, our diet, medication use.
That's a good point.
And science is now catching up, confirming some of that older wisdom, especially around the gut microbiome. The source even calls the gut a second brain.
Right, and highlights its role in the immune system, too.
Yeah.
And specifically for the over 55 group in the U.S., conditions like GERD, IBS, bloating, there are major concerns, according to the source.
Yeah, GERD apparently increases quite a bit with age, especially after 50. And while maybe fewer older adults get a new IBS diagnosis, those who do have it often report a worse quality of life, even if their pain scores are maybe lower than younger folks with IBS. It's interesting.
And bloating just seems to be everywhere, persistent.
It is. And these things are often tangled up together, aren't they? Influenced by those body changes with age, the pills someone might be taking, daily habits.
Yeah.
Understanding that bigger picture, like the source lays out, really helps us approach the solutions more effectively, I think.
Okay, let's really get into those root causes then. Starting with the natural body changes as we get past 55, then we'll layer on that medication impact. This is where the source gets really detailed.
It does. It outlines several key shifts. One really big one is a drop in the production of digestive enzymes and, importantly, stomach acid, hydrochloric acid.
And why is that drop so significant? What does it actually do?
Well, stomach acid is critical for a few things, breaking down food, especially protein, and also killing off any bad bugs, pathogens in our food.
Ah, okay.
So when acid levels dip, food doesn't get processed optimally before it hits the small intestine, and that can lead straight to gas, bloating, indigestion.
All right.
And it can even mess with the balance of gut bacteria. The source also mentions lower enzyme levels, like lactase, often explain why lactose intolerance pops up with age, causing bloating, diarrhea after dairy.
So less acid, fewer enzymes, food hangs around longer, maybe ferments, causes discomfort. Makes sense.
Yeah.
What else is changing?
The source points to slower gut motility, the muscles contracting to push food along. Those rhythmic contractions can become, less vigorous or maybe less coordinated as we age. And this slowdown is often really noticeable in the large intestine. So transit time increases.
Which leads directly to constipation, right?
Yeah.
Super common complaint.
Exactly. And then that backed up waste can make bloating and fullness even worse. Another crucial area the source talks about is the gut microbiome itself.
The bacteria.
Yeah. There tends to be a shift. Those potentially good guys like bifidobacteria and lactobacillus might decrease a bit. And maybe less helpful types increase.
And this imbalance, this dysbiosis, I think the source called it, that's linked to inflammation and can play a role in IBS and bloating symptoms too.
Precisely. The source also brings up actual structural changes, like the valve between the esophagus and stomach, the lower esophageal sphincter, it can weaken.
Ah, letting acid splash back up.
Exactly, leading to reflux, GERD. And things like weaker pelvic floor muscles can affect bowel control, too.
Plus, you might have less saliva or dental issues making chewing harder, so bigger food chunks hit the stomach.
Making that initial breakdown tougher. Yeah. But what the source really emphasizes, and I think this is often missed, is the huge impact of medications.
Okay, yeah, let's talk about that.
It's just so common for people over 55 to be on multiple prescriptions over-the-counter stuff.
Yeah.
And a lot of these can have significant digestive side effects.
This feels like a really critical piece. The source is highlighting what kind of drugs are we talking about?
Well, the source gives quite a few examples. NSAIDs are a big one, ibuprofen, naproxen, that sort of thing.
For pain, yeah.
Widely used. But they can really irritate or even damage the stomach lining, causing inflammation, ulcers maybe, worsening reflux, especially with long-term use in older adults. Some antacids, depending on what's in them, can cause either constipation or diarrhea.
And here's that slightly weird point. Again, drugs specifically meant to reduce stomach acid, like H2 blockers or PPIs for GERD. The source suggests they can sometimes reduce acid too much over time, which can actually lead to problems like SIBO, that small intestinal bacterial overgrowth, indigestion, bloating.
And even mess with absorbing nutrients like vitamin B12. Yeah. Opioid painkillers, notorious for slowing the gut way down. Major constipation.
Right.
Anticholinergic drugs used for things like overactive bladder, they can slow digestion too. Even common supplements like iron or calcium can cause constipation or irritation for some people.
Wow. The source even points out that drugs for totally unrelated things, high blood pressure, depression, Parkinson's, can have digestive side effects, like constipation or dry mouth.
And of course, antibiotics. Vital sometimes, but they definitely disrupt the gut microbiome, can lead to diarrhea. Even C. diff risk.
So it really makes you wonder, doesn't it? Like, the source implies how many digestive issues in older adults are actually medication side effects just being chalked up to getting older.
Exactly. The source really pushes for open, detailed chats with your doctor or pharmacist about everything you're taking and any digestive issues you have.
Because sometimes just adjusting the dose or the timing,
or even switching meds always under medical guidance, of course, could make a huge difference.
that communication piece with your doctor seems absolutely crucial based on the source. Potentially transformative.
Totally. Understanding these underlying body shifts and the drug impact really sets the stage for figuring out what the source says we can actually do about it all.
Great. So we've got the groundwork, age changes, medication effects. Now let's shift focus to what the source suggests for tackling those specific problems you might be facing, starting with bloating, that uncomfortable fullness.
Yeah, bloating and that visible distension.
Yeah.
Incredibly common. That feeling of being uncomfortably full, swollen, often with noticeable gas.
What are the main culprits behind this, according to the source?
Several things, really. One simple one is just swallowing aerophagia. Happens more than you'd think.
How so?
Eating or drinking too fast, talking while eating, chewing gum, smoking, fizzy drinks. Even dentures that don't fit quite right can make you gulp down air that gets trapped.
Huh. So just slowing down sounds like step one there.
It's one of the simplest things, but yeah, the source really emphasizes it. Another big cause is food not getting fully digested, circling back to those lower enzyme and acid levels in older adults.
Right.
Complex carbs especially.
Yeah.
If they're not broken down properly higher up, they reach the large intestine.
And the bacteria have a feast.
Exactly. They ferment them, producing a lot of gas. And certain foods are more likely culprits. The source mentions FODMAPs.
Ah, yes, the fermentable. Oligosaccharides.
Disaccharides, monosaccharides, and polyols. Yeah. Basically short-chain carbs that lots of people don't absorb well in the small intestine.
Like what kind of foods?
The source lists common ones. Veggies like broccoli, cabbage, onions, garlic, beans, legumes, dairy, if lactose is an issue for you, some fruits, apples, pears, and those artificial sweeteners like sorbitol.
So it's often about figuring out your specific triggers, not just cutting out huge food groups blindly.
Exactly. The source also points out constipation makes bloating worse. Retained stool creates pressure, makes it harder for gas to pass.
Makes sense.
And that gut bacteria imbalance, dysbiosis, can sometimes lead to SIBO small intestinal bacterial overgrowth, which causes excess gas production higher up in the small intestine.
And as always, if bloating is persistent or really bad, it could be something else like IBS or celiac. So seeing a doctor is key.
Always the right first step for persistent issues. But the source provides a whole toolkit of natural and lifestyle approaches that can really help for less serious cases.
Okay, lay some of those practical tips on us. What does the source suggest?
Top of the list, eat slowly. Chew thoroughly. The source highlights this as maybe the most effective thing.
Really? That's simple.
Seems basic, but yeah. Eating slowly cuts down on swallowed air. Chewing properly starts breaking food down mechanically, making it easier for enzymes later. Try actually putting your fork down between bites. Focus on the meal.
That takes practice, but I can see how it would help.
It's fundamental. Also, minimize those other air swallowing habits. Skip the fizzy drinks, maybe ditch the gum or straws. Try not to talk too much while eating. Check denture fit.
Okay. What about after the meal? Anything we can do then?
Light movement helps. The source suggests just a short 10-15-minute walk after eating. Gentle movement stimulates the gut, helps gas move through instead of getting trapped.
Ah, okay.
Deep belly breathing, diaphragmatic breathing is another technique the source recommends. It helps you relax, kicks in the rest and digest nervous system.
Parasympathetic?
Right, which can help relax gut muscles and let gas move along.
Wow, so breathing techniques actually impact digestion directly. That's fascinating.
It is. The source also suggests gentle heat, like a warm compress or a bath, can relax those abdominal muscles and ease discomfort. Even gentle massage, clockwise following the colon, can help encourage gas out.
And what about things to, like, drink? The source mentions herbal teas.
Yes, certain teas are known for being carminative, basically helping reduce gas. Chamomile is calming, helps relax gut spasms. Ginger tea is good for reducing gas and promoting digestion.
Peppermint, too.
Peppermint tea is a natural antispasmodic. Yeah, relaxes those digestive muscles. But, and this is a crucial note from the source, be careful with peppermint if you have GERD.
Oh, why's that?
It can relax that lower esophageal sphincter, the valve at the top of the stomach, potentially making reflux worse.
Good point. Always need to listen to your own body's reaction.
Totally. The source also talks about digestive enzymes and probiotics, fitting with that natural approach focus.
How do those help with bloating specifically?
Well, supplemental enzymes like lactase, if you know dairy is an issue, or broader ones for carbs, proteins, fats, can help digest food more completely.
Yeah.
Less undigested stuff reaching the bacteria means less fermentation, less gas.
Okay.
And probiotics, or even better, fermented foods rich in them. Kefir, plain yogurt with live culture, sauerkraut, kimchi. The source suggests gradually adding these can help improve that gut bacteria balance over time, which can reduce bloating.
So tasty fermented foods could actually be part of the strategy.
According to the source, yes. Dietary tweaks based on your triggers are also key. Maybe reducing those high FODMA foods if they bother you, or dairy if you're intolerant.
But again, don't just eliminate everything randomly.
No, definitely not. And the source really stresses soluble fiber oats, barley, apples, carrots. It tends to cause less gas than insoluble fiber, but you have to increase it really slowly with lots of water. Otherwise, it can backfire and make things worse.
Right. And critically, like we said before, checking in with your doctor about your meds if you suspect they might be contributing to constipation or bloating, that's vital.
Absolutely. And finally, the source includes a practical, maybe slightly funny tip. Don't hold gas in if you can help it. Finding a private spot can bring significant relief.
Okay, lots of actionable ideas there for bloating.
Right.
Now let's pivot to IBS and GERD. The source covers natural approaches for those two.
Right. IBS, irritable bowel syndrome. It's a functional gut disorder meaning abdominal pain, cramping, bloating, and changes in bowel habits. Diarrhea, constipation, or sometimes both alternating.
Sounds really tough.
Yeah, the source notes it doesn't cause visible damage like, say, Crohn's disease, but really impacts quality of life, and potentially even more so for older adults who have it.
So what natural strategies does the source recommend for managing IBS?
One of the big ones, with good evidence behind it, according to the source, especially for the diarrhea or mixed types, is the low FODMA diet.
Right. We mentioned FODMAS for bloating, but this is a specific diet plan.
Yes. It's quite structured. There's a temporary elimination phase, usually 4 to 8 weeks, where you strictly avoid all high FODMA foods.
Okay.
Then comes a careful, systematic reintroduction phase. The goal is to figure out which specific FODMA groups trigger your symptoms and how much you can tolerate.
That sounds complicated.
It is, and the source strongly cautions that this diet should really be done with guidance from a registered dietitian, especially for older adults, to make sure you're still getting all the nutrients you need during that elimination phase. It's meant as a tool to find triggers, not necessarily a forever diet for everyone.
That guidance seems really important according to the source. What about probiotics for IBS? Are they helpful?
They get a lot of attention in the source's discussion on IBS, yeah.
Yeah.
The thinking is that helping restore balance to the gut microbiome can calm things down, reduce inflammation, improve symptoms.
Any specific types mentioned?
Yes, the source actually names specific strains that have shown promise in clinical studies for IBS. Things like Bifidobacterium infantis 35624, Lactobacillus plantarum LP299V, and a Bacillus coagulans unique IS2.
So the source is saying the specific strain really matters here. It's worth looking for products with those if you're thinking of probiotics for IBS.
Precisely. Another thing the source points to is enteric-coated peppermint oil capsules.
Enteric-coated, meaning?
It means they have a special coating so they don't release the peppermint oil in the stomach, but further down in the intestines. There, its antispasmodic effect can help reduce that abdominal pain and bloating common in IBS.
Okay, but the same caution applies as with the tea.
Yes, exactly. The source reiterates. Avoid these if you have GERD because peppermint can worsen reflux.
Got it. And what about for people whose IBS is mostly constipation?
For IBS-C, the source recommends ground flaxseed. It's a good source of soluble fiber, helps absorb water, softens stool, adds bulk, promotes regularity.
How much?
Start small, maybe a teaspoon, increase gradually, and always, always drink plenty of water when you're upping fiber.
We touched on the gut-brain link earlier, but the source really emphasizes stress management for IBS specifically, doesn't it?
Oh, absolutely critical, according to the source. Stress is a huge trigger for IBS flares. The source lists things like meditation, yoga, deep breathing, tai chi.
Standard stress relief stuff.
Yes, but also highlights things like cognitive behavioral therapy, CBT, and even gut-directed hypnotherapy as being effective.
Hypnotherapy for the gut.
Yeah. These therapies work on changing how the brain perceives and reacts to signals from the gut, just reducing overall stress. It can directly impact IBS symptoms.
Fascinating how much the mind affects the gut. The source really reinforces that. And regular exercise helps too, right? For stress and motility.
Definitely. Physical activity, even just moderate walking, improves gut transit time, and it's a great stress buster, both helpful for IBS.
Okay, now let's talk GERD, gastric esophageal reflux disease. The source says this gets much more common and often worse with age.
Yeah, GERD is that chronic condition where stomach acid keeps flowing back up into the esophagus. Cause of that classic heartburn, maybe regurgitation, sometimes trouble swallowing or chest pain.
And why more common in older adults?
As the source explains, it's often linked to those age-related factors like a weaker lower esophageal sphincter valve, maybe slower stomach emptying. Things that just make reflux more likely.
And the source seems to really push lifestyle and diet changes as the first line of defense here, doesn't it?
They're presented as absolutely paramount. First off, avoiding trigger foods. The source lists the usual suspects: coffee, tea, chocolate, peppermint again, citrus, tomatoes, fatty or fried foods, spicy stuff, onions, garlic, alcohol.
Wow, that's a lot.
It is, but crucially, the source says you have to figure out your personal triggers. They vary a lot from person to person.
So, more detective work needed. What other dietary strategies does the source suggest?
Eating smaller, more frequent meals is key. Avoids overfilling the stomach, puts less pressure on that valve. Eating slowly, chewing well helps too. And then maybe the biggest timing thing. The source strongly advises not eating within 2-3 hours of bedtime. Let your stomach empty before you lie down.
Makes perfect sense. Gravity works against you otherwise.
Exactly. Which leads right into another highly recommended strategy from the source. Elevate the head of your bed.
Just with pillows?
No, not just stacking pillows that can actually bend you at the waist and increase pressure. The source means physically raising the head end of the bed frame by 6 to 8 inches. Using blocks under the legs or a wedge pillow under the mattress. Uses gravity all night long to help keep acid down.
That sounds like a pretty simple, practical change that can make a real difference.
It's one of the most emphasized non-drug interventions in the source. Also, weight loss, if you're carrying extra weight, especially around the middle, that excess weight physically presses on the stomach and the valve.
Right.
Avoiding smoking and limiting excess alcohol are also highlighted. Both can relax that valve and increase acid.
And wearing looser clothing. Avoiding tight belts.
Correct. The source mentions avoiding tight garments around the waist. Now, the source does talk about some traditional natural remedies for GERD, but with some important caveats about the evidence.
Okay, yeah. What does it say about things like DGL or slippery elm that you sometimes hear about?
Ginger water is mentioned as potentially soothing for some. Traditional remedies like DGL, that's diglycerinated licorice, or herbs like slippery elm or marshmallow root. They're listed as things that might theoretically coat and soothe the esophagus lining.
Might.
Yeah. However, the source explicitly states that strong scientific evidence specifically for GERD symptoms for DGL or slippery elm is limited. More research is needed.
So the source isn't really presenting those with the same confidence as the lifestyle changes.
Not based on the robust evidence discussed, no. Apple cider vinegar gets a mention, but the source notes there's no strong evidence it helps GERD, and being acidic, it can actually make things worse for some. Aloe vera. Very little scientific backing for GERD according to the source.
Okay, that context is really useful. It sounds like the source is saying, focus hard on the lifestyle and diet changes. They have stronger backing.
Right.
Be aware the evidence is shakier for some of those other commonly mentioned natural remedies.
Precisely. And the source stresses natural solutions for GERD are mainly for symptom management. They don't replace seeing a doctor, especially if symptoms are severe or persistent, or if you have other health issues. Always talk to your doctor before trying new treatments, natural or not, especially if you're on other medications.
So combining those informed lifestyle and diet changes with professional medical advice, that seems like the strongest path for both IBS and GERD based on the source.
That's definitely the comprehensive approach the source advocates.
We've touched on stress here and there, but the source really dedicates a good chunk to the broader impact of lifestyle stress, exercise, sleep, hydration. Let's dive into that a bit more.
Yeah, the source is super clear on this. Your digestive system isn't working in isolation. Yeah. It's deeply connected to your overall lifestyle, your mental state. And this connection is especially relevant for older adults dealing with chronic digestive stuff.
And that's the gut-brain axis again, right? That constant two-way street of communication.
Exactly. The source really emphasizes how chronic stress, anxiety, depression, they can directly mess with gut function, triggering or worsening pain, bloating, diarrhea, constipation.
And it goes the other way too.
Absolutely. Yeah. Persistent gut problems can really drag down your mood and mental well-being, especially true for IBS, which is known to be highly stress-sensitive. And for older adults, the source notes big life changes or health challenges can ramp up stress, which then directly hits the digestive system.
So actively managing stress isn't just like a nice-to-have wellness tip. It's a direct strategy for better gut health, according to the source. What techniques does it suggest?
Several proven ones. Meditation, mindfulness practices, even just short daily sessions focusing on your breath or body sensations can help calm the nervous system, dial down that stress response.
Okay.
Yoga and Tai Chi are recommended too. Gentle activities combining movement, posture, deep breathing, great for flexibility, balance, really suitable for older adults.
And deep breathing comes up again, linked to that rest and digest system.
Yes, diaphragmatic breathing specifically. The source highlights its ability to engage the parasympathetic nervous system, counteracting the fight-or-flight stress mode, helping relax gut muscles. It also mentions the effectiveness of psychological therapies like CBT and that gut-directed hypnotherapy for things like IBS, showing how changing brain processing of gut signals can actually reduce symptoms.
Plus, just doing things you enjoy, right? Relaxing hobbies, reading, gardening, pets, being outdoors.
Anything that genuinely helps you de-stress is beneficial. And then there's regular physical activity itself. Another key lifestyle factor the source highlights, beyond just stress relief.
How does exercise directly help digestion?
Well, the source explains it helps stimulate peristalsis, those muscle waves moving food along. Regular movement encourages the gut muscles to work efficiently, helps prevent constipation, reduces bloating by moving gas. Right. Plus, it's a great stress reliever in itself and helps maintain a healthy weight, which we know reduces risk for GERD and constipation.
And the source makes it clear it doesn't have to be super intense exercise, right?
Not at all. Brisk walking, swimming, cycling, dancing, even simple exercises at home, all effective. The goal is consistency, moderate intensity, aiming for maybe 30 minutes most days.
Okay. And sleep. That's another pillar the source mentions.
Absolutely fundamental. Sleep is when the body does a lot of repair work and regulation, including for the digestive system. Chronic lack of sleep can disrupt those natural digestive rhythms, potentially make symptoms worse.
So aiming for 7-8 hours of quality sleep is good for your gut, too.
It is. And having a regular sleep schedule helps regulate the body's internal clock, which includes gut function. Avoiding caffeine and alcohol near bedtime is also key. They mess with sleep and can trigger nighttime issues like reflux.
And hydration seems basic, but the source really flags it as essential.
Absolutely crucial. The source hammers this home adequate water intake, aiming for at least 8 cups, 64 ounces a day. Maybe more depending on your activity, the climate, your health.
Why is water so important?
It's vital for softening stool, making it easier to pass. Directly helps prevent constipation and the bloating that often comes with it.
And you get water from food too, right? Fruits, veggies.
That's a good point. Unsweetened herbal teas count too. And finally, the source really underscores avoiding smoking and limiting excessive alcohol.
How do they impact digestion?
Smoking weakens that lower esophageal sphincter, big-time GERD risk factor, contributes to ulcers too. Alcohol can irritate the gut lining, worsen bloating, diarrhea, reflux.
So the source really paints a picture of digestive health being holistic. It's not just about fixing one symptom, but nurturing the whole system through these lifestyle choices.
Exactly. Managing stress, moving your body, sleeping well, staying hydrated, avoiding those harmful habits. It all creates a better internal environment for your digestive system to just work smoothly.
Now, the source also spends some time tackling common myths and misconceptions about digestion, helping separate fact from fiction. Let's bust some.
Yeah, there's definitely a lot of folk wisdom out there that isn't quite right scientifically speaking. The source helped clear things up.
Okay, myth number 1. Spicy food or stress causes stomach ulcers. True or false?
False, according to the source. Stomach ulcers are primarily caused by either an infection, Helicobacter pylori, H. pylori bacteria, or long-term use of NSAID pain relievers like ibuprofen. Spicy food and stress can definitely aggravate an existing ulcer for some people, make the symptoms worse, but they don't actually cause the ulcer in the first place.
Good distinction. Okay, myth number 2. Heartburn always means you have too much stomach acid.
Also not necessarily true, especially in older adults, says the source. Heartburn is caused by stomach acid getting into the esophagus.
Yeah.
But while too much acid can be a factor, the source points out that often, particularly in older folks, the main issue is a weaker valve, that lower esophageal sphincter, or maybe a hiatal hernia. This allows even normal amounts of acid to reflux more easily.
So it's more about the barrier failing, not necessarily excess acid.
Often, yes. And the source even adds that surprising twist. Sometimes older adults might actually have low stomach acid, which slows digestion, leads to fermentation, pressure builds up, and that can push stomach contents upward, feeling like reflux.
Wow, low acid contributing to reflux symptoms. That's really counterintuitive based on the source.
It is. And it shows why understanding the why is so important. Okay, myth 3. Only older adults get digestive problems.
Definitely false. I know plenty of younger people with issues.
Right. The source confirms things like IBS, GERD, constipation, bloating. They affect people of all ages. However, some conditions, like GERD, do tend to become more common or maybe more severe with age because of those body changes and increased medication use we talked about.
Makes sense. Myth 4. All fiber is good for all digestive problems.
The source clarifies this one nicely. Fiber is essential, yes, but there are different kinds. Insoluble fiber adds bulk, speeds things up. Soluble fiber forms a gel, softens stool, feeds good bacteria. So while overall fiber is crucial, for some people, maybe with certain types of IBS or bloating-specific high FODMAP fibers or just too much insoluble fiber too fast, can actually make symptoms worse. The key is finding the right type and amount for your body and your condition.
Right, it's personal. Myth 5. A gluten-free diet is good for everyone's digestion.
The source says nope, not necessarily. A gluten-free diet is medically required only for people diagnosed with celiac disease, which is an autoimmune reaction to gluten, or those with confirmed non-celiac gluten sensitivity.
And for everyone else.
For people without those conditions, cutting out gluten can actually mean missing out on beneficial whole grains and might even negatively affect the gut microbiome diversity.
Interesting. Myth 6. Probiotics are a magic bullet for all gut issues.
The source acknowledges probiotics can be really helpful for specific things, improving microbiome balance, maybe reducing antibiotic-related diarrhea, helping with some bloating or IBS symptoms, but...
There's always a but.
Yeah. The source strongly emphasizes that effectiveness varies hugely. Depends on a specific probiotic strain and the specific condition you're trying to treat. They're definitely not a guaranteed fix for everything.
Good reminder about strain specificity again. And finally, a classic. Chewing gum causes diarrhea and stays in your stomach for 7 years.
The source definitely debunks the 7-year myth. Gum is indigestible, sure, but it passes through like other indigestible matter relatively quickly. However,
However.
the source does note that chewing a lot of gum can lead to swallowing more air, which, as we discussed, can contribute to bloating and gas.
Okay, so a tiny grain of truth related to bloating, but the 7-year thing is pure myth. Thanks, source, for clearing those up. Understanding the facts really helps make better choices.
It really does. It's empowering.
Okay, so we've covered the age changes, the medication impacts, specific issues like bloating, IBS, GERD, the lifestyle factors, busted some myths. How do we actually take all this great info from the source and turn it into action? The source talks about building a personal plan.
Right. This is where the rubber meets the road, so to speak.
Yeah.
The source outlines a kind of step-by-step process to help you integrate all this into your life for better digestive wellness.
And step 1 is basically becoming a detective about your own body, isn't it?
Exactly. Start by keeping a detailed symptom journal. The source suggests doing this for at least a couple of weeks. Note down exactly what you eat and drink, when you eat, when symptoms pop up, what kind of symptoms, how severe.
Your stress levels too, mood.
Yep, stress, mood, any medications or supplements you took that day. It creates a really clear picture to help you spot potential triggers and patterns.
Okay, journal first. Step 2 then involves making dietary changes based on what that journal reveals.
Yeah, the source recommends focusing on a diet rich in whole, unprocessed foods. Lots of fruits, veggies, lean proteins, whole grains, healthy fats. Gradually increasing fiber is crucial.
Gradually being the key word.
Definitely. Starting slow, especially with soluble fiber oats, apples, beans, carrots, and increasing over time. And making sure you drink plenty of water to help that fiber work properly.
And keeping up that habit of eating slowly, chewing thoroughly.
Absolutely essential. The source keeps coming back to that. Breaking meals into smaller, more frequent ones, maybe 5 or 6 small instead of 3 large is also suggested. Less load on the system at once.
Okay.
And consistent hydration, that 8+ cups of water, daily foundational, especially with more fiber.
And using the journal then to pinpoint and deal with specific trigger foods?
Yes. If your journal points strongly to certain foods, maybe fizzy drinks, really fatty or spicy things, high FODMAP items, if you suspect IBS, the source suggests trying a temporary elimination of those suspects, just for a short time. Then reintroduce them one by one to confirm if they really cause issues for you.
Okay.
The source also encourages trying to incorporate those fermented foods, plain yogurt with live cultures, kefir, sauerkraut gradually, to support a healthy microbiome.
And thinking about supplements like digestive enzymes or specific probiotics.
Yes, but always, as the source stresses, discuss these with your doctor or a registered dietitian first. Make sure they're appropriate for you, figure out the right type.
Got it. So step 3 is optimizing lifestyle, integrating all those factors we discussed.
Right. Regular physical activity, aiming for that 30 minutes moderate activity most days. Even short walks after meals help. Stress management is non-negotiable. Find techniques that work for you. Mindfulness, yoga, breathing, hobbies, and practice them consistently.
Prioritizing sleep to 7 to 8 hours, regular schedule.
Yes, sleep health is gut health. And definitely avoiding smoking, limiting alcohol. Maintaining a healthy weight is also listed. As the source notes, losing excess weight can significantly help, especially with GERD.
And step 4 sounds like the most important. Consult your doctor.
Non-negotiable, according to the source. If you have symptoms that are persistent, severe, getting worse, or if you experience any of those red flag symptoms.
Remind us what those were.
Unexplained weight loss, blood in your stool which could be bright red or look black and tarry, persistent vomiting, real difficulty swallowing, severe abdominal pain, or sudden major changes in your bowel habits that don't go away.
See a doctor immediately for those.
Absolutely. And take your symptom journal with you to the appointment.
And be ready to talk about all your medications, prescription, and over-the-counter.
Crucially important, so the doctor can check for drug side effects. The source also suggests maybe consulting a registered dietitian who specializes in gut health or a gastroenterologist for more tailored guidance.
It really sounds like a process, doesn't it? Not just a quick fix, as the source implies.
Oh, absolutely frame it that way. Improving digestive health is a journey. There will be ups and downs. The source encourages patience, being kind to yourself, experimenting to find what works for your body.
Uh-huh.
and consistently listening to your body's signals. Being proactive, armed with the info from your source material, can really help you gain better control and just enjoy life more comfortably.
The source even includes a couple of brief examples, right, showing how people applied these ideas.
Yeah, they provide some relatable scenarios, like Mary, 68, struggling with bloating and constipation bad enough it was affecting her comfort, her social life.
What does she do?
Well, following the source's advice, after seeing her doctor and starting that symptom journal, she figured out dairy and certain raw veggies were triggers for her.
Okay. So what changes did she make?
With guidance, she gradually cut back on dairy, used lactose-free options, started cooking veggies thoroughly, ate smaller portions. But critically, she focused on how she ate, like the source emphasizes. Slowed down, chewed really well, added a 15-minute walk after dinner. She also started doing daily deep breathing exercises.
And did those seemingly simple things help?
The source says yes, within weeks. Big improvement. Bloating decreased dramatically. Constipation got better as she slowly increased soluble fiber and water. She felt lighter, more energetic, more comfortable going out.
Wow. That really shows how those small, consistent steps the source suggests can add up to major improvements.
It's a great example. There's another one, John, 72, with chronic GERD, bad nighttime heartburn disrupting his sleep.
What did he try?
Instead of just relying on meds right away, he decided to really commit to the lifestyle changes from the source after checking with his doctor.
Yeah.
He elevated the head of his bed with a wedge pillow key strategy, changed his diet to avoid his triggers, spicy food, fried stuff, coffee, especially later in the day, switched to smaller, more frequent meals, made sure he finished eating 3 hours before bed, added morning walks for stress and general health.
And the outcome for John?
The source reports, despite it being challenging at first, his consistency paid off. Nighttime heartburn dropped significantly. He slept better, felt much more rested.
Those stories really drive home the source's point. Informed, patient effort with these natural and lifestyle strategies can bring real relief and better quality of life for digestive issues in older adults.
They really illustrate the potential, yeah. And to back this up, the source also includes insights from recognized experts and organizations.
Like who?
Dr. Gerard Mullen, a gastroenterologist at Johns Hopkins, is mentioned. He emphasizes how age naturally slows digestion, affecting acid, immunity, the microbiome. He stresses the need for enough fiber. Most Americans don't get enough, and highlights that stress-gut link, saying, quote, "No magic diet can fix GERD if stress isn't managed." Recommends relaxation techniques.
So, stress management isn't just fluff. It's medically recommended by experts cited in the source for gut health.
Absolutely. Registered dietitians, RDs, mentioned in the source, advocate for balanced, fiber-rich diets, whole foods, hydration, stressing the right type and amount of fiber. They reinforce that expert RD guidance is crucial for complex diets, like low-FODMAP, especially for older adults, to avoid nutrient caps. They also support fermented foods and advise talking to a doctor before starting probiotics.
And gastroenterologists, like from the American Gastroenterological Association, AGA, what's their perspective according to the source?
They emphasize that while natural strategies and lifestyle changes are fantastic, they don't replace professional medical care, especially for severe or concerning symptoms. They strongly echo the warning about medication side effects in older adults and repeat the need to review all meds with your doctor.
So the overall consensus from the experts presented in the source seems clear. It's about a comprehensive, personalized approach.
Exactly. Integrating healthy eating, consistent activity, managing stress effectively, getting quality sleep, and getting timely medical advice when needed. That's the most powerful path, especially for Americans over 55.
We have covered so much ground in this deep dive into your source material. Let's try and quickly recap the absolute key takeaways.
Okay. First, understanding the why is crucial. Those age-related body changes, less enzymic acid, slower movement, microbiome shifts, weaker valves, they all play a part. Plus the often a huge impact of common medications.
Right. Then, strategies for specific issues. Bloating. Eat slow, chew well, walk, deep breaths, maybe ginger chamomile tea, consider enzymes or fermented foods, adjust diet carefully, add fiber slowly.
IBS, guided low-FODMAP trials, specific probiotics like B. infantis 35624, L-plantarum, LP299V, B. coagulin's unique IS2, maybe peppermint oil capsules carefully, flaxseed for constipation type, and major focus on stress management.
GERD, lifestyle, and diet are king. Avoid your triggers, smaller meals, no late-night eating, elevate the bedhead, weight management, quit smoking, limit alcohol. Source notes limited strong evidence for some traditional remedies like DGL slippery elm.
And what really ties it all together in the source is how fundamental lifestyle is. Stress management, exercise, sleep, hydration, they're foundational because of that powerful gut-brain connection.
And the source helped clear up myths. Ulcers from H. pylorans ADAIDs, not spice stress. Heartburn, often a weak valve in older adults, maybe even linked to low acid sometimes, not always excess acid.
And the experts cited Dr. Mullen, AGA. They reinforced that whole picture. Fiber, stress, medication review, and knowing when to call the doctor.
This source material really has provided an incredibly detailed roadmap for anyone over 55 trying to navigate digestive health. So how do we translate this into action? What should you, listening in, think about doing next based on this deep dive?
Yeah, the source gives a clear call to action, really. And the main message is, don't get overwhelmed. Don't try to do everything at once. Start small. Pick one or two changes that seem most manageable or most relevant to your main symptoms and commit to them consistently.
Like maybe just consciously slowing down, eating and chewing more, or adding that short walk after dinner.
Exactly. Simple, achievable things. Or, if GERD's the issue, maybe focus on elevating the bed and stopping eating a few hours before lying down. And the source strongly recommends keeping that symptom journal for a couple of weeks.
That detective work again.
It's presented as the most effective tool for you and your doctor to figure out your specific triggers and patterns.
And take that journal with you when you see the doctor.
Please do. The source really emphasizes talking openly about your symptoms, what you've tried, and reviewing all your medications, prescriptions, over-the-counter, supplements, everything. Your doctor needs the full picture.
To rule out serious stuff, check for drug side effects.
Exactly. And maybe refer you to a specialist like a dietitian or gastroenterologist if needed. Prioritize hydration and fiber. They're bedrock principles. But remember, add fiber slowly. Drink plenty of water.
And find a stress management technique that actually works for you and helps you relax. As the source shows, your gut and brain are totally linked.
The source also suggests maybe trying to incorporate fermented foods, kefir, yogurt with live cultures, or discussing a specific probiotic with your healthcare provider to see if it might be suitable.
It really feels like an ongoing process, doesn't it? Learning, adjusting.
The source definitely frames it that way. Be patient. Listen to your body. Keep experimenting with the strategies here. And don't hesitate to get professional help if things aren't improving or seem worrying. Being proactive with this knowledge can really empower you.
This has been such an incredibly valuable deep dive into the material you shared with us.
It really provided so many practical, evidence-based insights, specifically tailored for this age group. It was great material.
And for anyone listening who wants to explore more, the source did helpfully list several reliable U.S. resources. NEDDK, that's the National Institute of Diabetes and Digestive and Kidney Diseases, the AGA, American Gastroenterological Association, AARP, Johns Hopkins Medicine, and Medline Plus. Good places for more solid info.
Yeah, and the source even included a kind of FAQ section, anticipating common questions, like, do I automatically need digestive enzyme supplements just because I'm older?
And the answer was?
Basically, no, not automatically. While age can decrease enzymes, supplements aren't needed for everyone. If you have persistent indigestion, especially after protein or fat-heavy meals, they might help, but always discuss with a doctor or dietitian first to see if they're right for you and which type.
What about the safety of the low-FODMAP diet for older adults?
The source says it can be effective for finding IBS triggers, but absolutely needs supervision from a registered dietitian, especially for older adults, to make sure you don't miss out on key nutrients during that restrictive phase. And remember, it's usually a temporary diagnostic tool.
Beyond water and fiber, any other natural constipation relief tips from the source?
Regular physical activity is a big one. Even gentle walking stimulates the gut. Beyond that, for further relief, it's best to get medical guidance, maybe discussing osmotic laxatives like polyethylene glycol or stool softeners, while being cautious about overusing stimulant laxatives.
And the big one. When is it really time to stop trying natural stuff and definitely see a doctor?
The source is crystal clear here. See a doctor if symptoms are new, getting worse, severe, or if you have any of those red flag symptoms we mentioned, unexplained weight loss, blood and stool, constant vomiting, trouble swallowing, severe pain, or sudden, persistent changes in bowel habits. Don't delay.
And finally, that question about why stress hits digestion so hard.
It's that powerful gut-brain axis the source detailed. The gut has its own huge nervous system directly wired to the brain. Stress triggers hormones and signals that change gut movement, secretions, and inflammation, even the microbiome balance, all leading to digestive symptoms. Managing stress is crucial because of this direct physical link.
This has been a truly comprehensive look at the challenges, but maybe more importantly, the actionable, natural, and lifestyle solutions for digestive health over 55, all drawn right from your source material.
It's really empowering, isn't it?
Yeah.
To see that with informed choices, there's so much you can potentially do to improve comfort and quality of life as you age.
So here's a final thought to leave you with, stemming from everything we've discussed based on the source. Given that deep connection between the gut and the brain, and how digestive health clearly influences not just physical comfort, but also mood, sleep, energy, could prioritizing your digestive health actually be one of the most direct ways to boost your overall well-being and even your mental state as you get older? Something to really mull over.
That's a provocative thought indeed, and one the source material definitely supports with all its interconnected themes.
Well, thank you for bringing this incredibly valuable source material to our deep dive. It was a truly insightful exploration.
My pleasure. It was fascinating to delve into it with you.
And thank you, our listener, for joining us on this deep dive. We really hope this information empowers you on your journey toward better digestive health. Remember, the source suggests starting small, listening to your body. And please feel free to share this deep dive with anyone you think might benefit. Your feedback helps our community grow.
Take care of your gut, and it'll take care of you.
See you next time for another deep dive.